MitoCanada
Sure.
is celebrating its 10-year anniversary this year. A few areas MitoCanada has had significant impact is improving genetic diagnosis by funding next-gen DNA sequencing awareness campaigns like running Guinness World Records that have reached millions of people and impacted over $3 million in research. Can you talk about the impact having a patient advocacy organization like MitoCanada has meant for you as a scientist and clinician in this field who sees patients every day?
Yeah, I think the most reward I get from this is to see the patient advocacy and also how it brings people together. When I go on a mito walk and other events and I see patients that I'm usually seeing in a sterile environment, but I see them out raising money for mitochondrial disease, people getting to know each other, adults, children, everybody. It's really rewarding because I think a lot of people with rare diseases become somewhat isolated, and some of the children as well, because of their complex needs, just don't have the opportunity to go out and see other kids and play the way your average kid can. And so certainly a lot of the events and the links that MitoCanada has afforded to the patients, I think, is absolutely fantastic. From a research perspective, again, really important. Mitochondrial disease is relatively rare disease because of MitoCanada and the recognition that aging has a mitochondrial component and obesity and diabetes do. Mitochondria are coming to the forefront of scientific excitement, for lack of a better term. But in the early years, people said, "Mito, what? We have no clue what this is." So trying to get money from CIHR or NSERC was next to impossible. So some of the seed money that MitoCanada was giving out, and we were the early recipient of one of their grants, really helped us to advance our research. In fact, some of the early projects that we were involved in, one of them was funded from MitoCanada, looking at exercise factors which stimulate the increase in mitochondria. That whole concept was pretty seminal for me starting a company called Exerkine, which reflects these exercise factors that are released which cause mitochondrial biogenesis. And from our company called Exerkine, we're actually going to be giving back some of the net profits back to support MitoCanada in recognition of the great work they're doing and the fact that they started very early on in my career to support some of my research.
Well, that's great. And so as a clinician and researcher, looking at the future of mitochondrial therapies, what excites you the most that will be able to improve the lives of people living with the mitochondrial disease?
Yeah, there's so many areas, it's difficult to pinpoint one, but certainly, as you mentioned, the next generation sequencing for rapid diagnosis. I have seen many examples, and we're seeing more and more where early diagnosis and early treatment is really the most effective therapy. And until we can identify and correct a genetic defect, which we still can't do in medicine, I think early identification of the disease before there's damage is so important. Whatever therapy we do, be it exercise, nutrition, different drugs, if we start it before there's irreparable damage, that's when we have an opportunity to treat. Once you've had a stroke, for example, or you've got irreversible heart damage, as the term implies, you really can't go back. And any therapy then, I think, is difficult. For example, if you had Duchenne muscular dystrophy and you were so weak and so contracted that you were in a wheelchair and you couldn't move, even if I cured that person genetically, they're still stuck in a wheelchair and not moving. So I really think that early genetic diagnosis, and we've seen it now with another disease that we deal with called spinal muscular atrophy, where it's now part of a newborn screening. So if we can identify it before the kids start to get weakness and start a gene therapy on those kids, that's where we have the huge impact. Once they're already weak and in a wheelchair, there's really no going back, even though we do have gene therapies, they just don't work if you've already got damage. So to me, I think that's a huge advance, and certainly the work that Anil Khan is doing with rapid genetic diagnoses in the intensive care unit, something I saw a kid tonight, for example, before I came home. Enlarged heart, lactic acid should be 2, and the lactic acid in this unfortunate child was 8 chronically. So we're suspecting mitochondrial disease, and it used to be 4 months before we could get a diagnosis. Now with Anil's rapid turnaround, we can get that in a few days. So that's exciting. And I think the other final thing is when we start thinking about different therapies. In the old day, we had various nutritional supplements called the mitochondrial cocktail, and we've shown that those are helpful. But now people are getting so excited about mitochondria that there's at least 5 different companies that are trying to make mitochondrial drugs to improve mitochondrial function. So I think it's pretty exciting, because one person working on it's not going to solve the problem. It's going to take many, many people, many years, just like it took billions of dollars to solve cancer for kids with leukemia.
Well, I certainly appreciate that perspective, and it is always refreshing to hear from a clinician and a researcher such as yourself be hopeful, and this opportunity we have to share that is what we've been hoping to be able to raise that awareness and to show the full network of patient research and all these people working together to create therapies at this point. So what does it look like for you? What would it look like for you to say, what does a cure look like for you for mitochondrial disease? What does that?
Yeah, it's a challenge because every disease is so different. So for example, there's one called Leber hereditary optic neuropathy, which is much more common in men. And when they're teenagers and the prime of their life, just starting off with their career and their spouses and stuff, they get blindness in one eye and then it goes to the other eye. So again, early diagnosis of that, knowing who's susceptible to this, and decreasing the risk factors which make these kids go blind is effectively a cure. So we know that smoking is a powerful trigger for that disease. So if you identify it before you damage, then I think right there, that's pretty much a cure, even though you're not changing the genetics. That's number one. Other cures, for example, I mentioned that there's the mitochondrial gene and the nuclear gene. We are starting in medicine to come up with certain genetic therapies where we can use viruses to express the gene that's missing. And those are starting to become more available in certain diseases. And some of the mitochondrial disorders may be amenable to that type of therapy. And then finally, there are some cases where a bone marrow transplant can be helpful. One example would be Menge syndrome, where a bone marrow transplant can sometimes purify the toxins that are produced from the dysfunctional mitochondria to have a profound impact. But even there, we still have to identify these diseases before there's irreparable damage, and that's really the main first step towards effective therapy.
Any final words of wisdom to motivate us to keep moving, to look after our mitochondria?
Well, I think for those raising money, I think it's important to go out and experience what your mitochondria are doing for you. Go and walk up a hill and feel that shortness of breath, that fatigue that you experience, and then reflect upon what it must be like to have mitochondrial disease and for that to be part of everything that you do day in, day out. And I think that gives motivation to people to help raise money, to be more aware of the impact of mitochondria and how important they are to all of our health. I guess a crazy thought would be, which I often use, is that every one of us has a mitochondrial disease called aging. So if you don't think it's important, you're in trouble because you're all going to eventually have mitochondrial dysfunction, and that's going to be the end of you at some point. So the more we learn about these beasts, the better we can help people with primary mitochondrial disease. But importantly, as time goes on, what we're learning, I think we're also going to help the older adults who have mitochondrial dysfunction. We're going to help the diabetics. We're going to help with obesity. And certainly when I look at so many of my colleagues and people that I talk to who with the COVID-19 crisis aren't moving anymore, everyone's putting on a few pounds. I think everyone can get their mitos moving and it'll be good for them.
It certainly is the case. And there's two ways I think to come out of this COVID. There's been jokes about that, whether you come out determined and more fit because you've had more time, you've used this time to actually do more exercise, or you've decided to be more sedentary. But certainly being the first option, I think, is the best, is that, yes, you're right. We should be exercising more. And I think that we have that opportunity to motivate some people to go out and have a run, get out, exercise, go for a walk, go for a bike, just get those legs moving or those arms
Absolutely.
moving. Do what you can.
Yep.
And I really appreciate you sharing your perspective on this today, Mark. And have a great run.
Thanks. I always will, and I always do. Thanks a
All
lot.
right.